I think Sajid Javid has a point here, doesn't he? That, a lot of other countries treat their elderly relatives very differently to the way that we do.
Well, I think given the choice, all of us would like to grow up in happy, secure families. And as we get older, be surrounded by children and grandchildren who, as we get more frail, will provide us with the support we need. And it may be that we go to live with them. That sometimes works in some families. I think my late husband and my late mother would have murdered each other had they had to live in close proximity. It doesn't work for every family, but we saw her all the time and I spoke to her every day, and that she knew how important she was in my life. But
And
I have a friend who I've never met, who I only know because she wrote to me about how important Silverline was. And she nursed her husband for 6 years until he died. She had carers who helped her because she said it got to the stage when it was a matter of chance whether she or her husband fell over first in the shower. She's 90 and she suffers from extreme agoraphobia. She never, ever goes out. And she has outlived all but one of her family. They were a small family to begin with. And she has one child who is still alive. She lost one of her children. And if she didn't have carers night and morning, who would be there to support her? She says she's quite disabled. As I say, I've never met her. I speak to her once a week. And apart from her one child and me, and the warden of her development, which is for older people, she doesn't talk to anyone. Now, since November 2018, she has had 67 different carers. She never knows when they're going to come. She never knows who's going to come. She gets up at 6:30 every morning because they tell her they will be with her between 7 and 9. And sometimes they're not with her until 9:30. So what do we do, Mike? What do we do as people? She's a lady who has contributed so much during her life. She's very intelligent. She's great company over the phone. I love my conversations with her. What do we do?
And what would be the situation, for example, if she wanted to, or if it was suggested that she went into a care home?
Well, she's put us up on a waiting list of supported living. I think there are some very good new developments which start off with you getting a flat or maybe a little house in which you live completely independently. But if you do become more frail, you can move into other properties in the same development where the staff that you have got to know because they work around the place and they provide more care for you. And that works very well. But I remember when I was possibly the least successful independent candidate in the whole general election of 2010, one of the invitations I had was to go and visit a care home for older people. And one of the staff sat next to me and said, Esther, it's really sad for us that we're always regarded as the last resort because we are providing proper food, activities, company, and somewhere safe for people who would really be at severe risk if they were still living in their own homes. And yet people think of care homes only as the last resort.
Yes. And the trouble is, I suppose there's so many differences in each care home depending on who's running them as well.
Yeah, I mean, a friend of mine introduced me to a care home where her mother was looked after in the Midlands, which they describe as a cruise ship on land because it's got all those things. It's got fabulous food. I've spoken to the owner and he was very careful during COVID. He didn't accept people who local hospitals tried to get him to take on because they hadn't been tested. He doesn't have any agency staff, so they weren't going from place to place taking infections with them. So he managed to keep COVID out of his care home. Now, we don't hear those wonderful stories, do we?
No, we
Because they
don't.
don't hit the headlines, no.
That's the problem. But I mean, looking at some of the Tory policy in the Telegraph this morning, supposedly this new kind of cap that's coming in, so that you'll never have to pay more than £86,000 for social care, isn't even going to come in until October of 2023. So it's a couple of years away, basically.
Yes. It is sad, isn't it, how looking after older people is so far down the national agenda. And I really don't know, Mike, why it is. Why is it? If you have a look, when we joined, we had real problems on the Silverline trying to get funding because it didn't appeal to the public compassion in the way looking after cats and dogs sometimes does. Anyway, I had a look at the most popular charities in Britain, and you won't find one working with older people in the top 10, the top 20, or the top 30, or the top 40. Age UK comes at 46.
That's amazing. And why do you think that is then? Do you think we just don't care?
Well, I think
we don't care enough.
There's a certain amount of dread in it. We don't want to think that we're going to be like that one day. We're going to be disabled. We're going to not have a job. We're going to perhaps not get out and about, not drive our own car. You know, there's a certain amount of loss associated with older people. Then there's the famous phrase, well, you've had a good run. You see, I'm 81, so I've had a very good run.
Yes.
You know? So if I drop off my perch, immediately I've spoken to you, but not before, Mike.
Certainly not.
Certainly not. People will say, well, she had a good run, won't they?
Well, my mother's 97, so you've got quite a good long run to have as well, I would say.
Well, there you are. That's a very clever decision of yours to pick her as your parent. You know, genetics very important.
Well, I think so. And she is still in pretty good shape. She actually lives in America with my sister, who's just come to visit me today. And I'm going to go visit them at Christmas time because I haven't been able to see her for 2 years, which is a bit frustrating. But she is not in a home. She's got her own accommodation where she gets looked after and she gets visited by people. But happily, she's quite healthy. But not everybody has that. And the dementia side of things is a really difficult problem, isn't it?
Well, I think it's what we all dread more than anything else, probably, don't you think?
Yes.
That, I think most of us can put up with the prospect of losing physical strength. Obviously, nobody wants to do that. But the idea of losing our personality, you know, losing who we really are, losing our capacity to think for ourselves is the most frightening, I think.
Yes.
And I think that if we can find a treatment, sometimes there are green shoots, aren't they? People tell us that there is something on the horizon that may help us cure and prevent dementia. And that will make a difference, not only to older people themselves, but the way we think of older people and the way that we think of old age, because I think we dread it at the moment.
Yes, I think. And is there a better model than the one that we currently have in terms of private sort of care homes? Because, you know, some care homes will take elderly people if they haven't got any money because the council will pay for that. Other people will have to pay for their own if they have houses or they have money. But I mean, a lot of these care homes make an awful lot of profit as well.
Yes. While at the same time, the people who work in them, the actual care deliverers, very often get paid very little. And, you know, I was talking to one of our Childline supervisors, a fantastic woman who joined Childline because she had a most terrible childhood and Childline was there for her. And she said the first kind of care she went into was looking after older people, and she absolutely loved it. But she got into terrible trouble because she was only supposed to be there for 10 minutes for each visit. But the first thing the older person will say is, can I make you a cup of tea? Shall we have a cup of tea together? Shall we have a little talk together? And she would sometimes stay there an hour because she knew what they most needed was human contact and conversation.
Yes.
So I think that what we need to do is up the status of the people who work in care homes or work in domiciliary care, looking after older people in their own homes. But first of all, of course, we've got to value the older people themselves.
Yes, I think that's where it all begins. Well, Dame Esther, lovely to talk to you again. Thank you so much for joining us, and we'll speak, I'm sure, again very soon. Dame Esther Rantzen, founder of Silverline, there, saying some very sensible things about care homes and the care home business and the care home problem that we have in this country, which we will definitely explore a little bit more, I think, because we haven't got a lot of time to do it in this particular show, but we will revisit it because Sajid Javid says care should begin at home, particularly social care. And I think he's got a point. But it ain't that easy, is it? 0344 499 1000 is the number. This is Talk Radio.
Online, on DAB, and on the Talk Radio app. Talk Radio.